Good afternoon and welcome to the 138th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at Drexel University in Philadelphia. Today I'm going to talk about COVID-19 in Bangladesh and food insecurity issues with Hannah Rushek and Maheen Khan. Just a reminder, you can catch COVID Calls live every weekday at 5 p.m. Eastern Time on YouTube. Just go to the COVID Calls YouTube channel to watch. You can also watch COVID Calls on Facebook Live and on Periscope. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and topics, and please feel free to suggest yourself as a future guest. As of today, September 30th, 2020, 10,288 deaths globally from COVID-19. That's according to the Johns Hopkins University Coronavirus Resource Center. In the United States, there are 7,216,828 cases of COVID-19 reported. That's up from 7,156,562 reported yesterday. There are now a total of 206,615 deaths reported in the U.S., up from 205,268 reported yesterday. The global death toll now is over 1 million. As a way to bring some humanity to the numbers, I've been reading a life story or a story of advocacy for those impacted by the pandemic in some way. I'd like to continue that now. Kamal Ahmed, who helped Bangladeshi Americans, dies at 69 by Daniel E. Slotnick. This appeared in the New York Times May 20th. Kamal Ahmed spent decades catering to dignitaries, diplomats, and presidents as a banquet worker at the Millennium Hilton Hotel at One United Nations Plaza in Manhattan. Outside of work, Mr. Ahmed, who immigrated to the United States in 1977 from Bangladesh, was a rock for his relocated compatriots. He was twice elected the leader of the Bangladesh Society of New York, which has 28,000 registered members. In that role, he helped newcomers from his homeland find jobs and apartments and created a sense of belonging in a vast and often indifferent metropolis. More recently, Mr. Ahmed also supported them at the end of their lives. He helped dozens of society members who died from the novel coronavirus find a grave in burial plots the society had bought on Long Island, New York, and in New Jersey for members who could not afford them. Mr. Ahmed died on April 5th at a hospital near his home in Elmhurst, Queens. He was 69. His daughter, Ramana Ahmed, said the cause was complications of COVID-19. Kamal Uddin Ahmed was born January 1st, 1951 in Sylhet district in eastern Bangladesh to Shamsun, a homemaker, and Zia Ahmed, an elementary and high school teacher. He grew up in Bianabazar, a town in Sylhet, and studied agriculture before moving to the United States, where his father had settled for better opportunities. He got a job at the Hilton, starting as a busboy and eventually becoming a banquet worker, and became a citizen in 1982. He also worked as an office manager for personal injury lawyer H. Bruce Fisher in Queens and became involved with Bangladeshi American groups. He led one for people from Bianabazar and one for people from Bangladesh's Jalalabad region before he became the president of the Bangladesh Society. Azimur Rahman, a member of the society and a banquet server at the Algonquin Hotel, who had known Mr. Ahmed since they lived in Bangladesh, credited Mr. Ahmed with starting Bangladeshi language and culture classes at the society so that children who grew up in the United States might have a greater understanding of their heritage. Mr. Ahmed married Afsari Begum in 1980. In addition to his wife and daughter, he is survived by a son, Rofi, 5 brothers and 5 sisters, and a grandson. Mr. Ahmed was buried in Mount Sinai, New York, in a plot near those the society provided for its members, but his grave was paid for by his family, said Rahul Siddiqui, the society's general secretary. He said that when I die, I will not use anything from the Society for Needy People, Mr. Siddiqui said. Okay, let's turn to our discussion for today. Really pleased to introduce my guests. Maheen Khan is a writer and co-editor for the Voices from the Frontline initiative by the International Center for Climate Change and Development, ICCAD, and also for CDKN. She is a communications specialist and has 10 years of professional experience across multiple sectors, including education, data and technology, and sustainable textiles. Maheen was the founder and creative director of Monochrome, a sustainable fashion startup in Bangladesh. At Monochrome, she successfully implemented the circular design economy as its business model. Maheen is currently reading her master's in science and sustainability science, policy, and society at Maastricht University in the Netherlands. She was born in Bangladesh and had previously attained a Bachelor of Commerce in Marketing and Demography from Macquarie University in Australia. Hannah A. Rushik is a feminist urban geographer at Durham University's Institute of Hazard, Risk and Resilience and the Department of Geography in the UK. She is interested in how the world's invisible majority live in academically overlooked smaller cities. Her forthcoming edited book, Overlooked Cities: Power, Politics, and Knowledge Beyond the Urban South, will be out with the Routledge Studies in Urbanism and the City series later this year. Before academia, Dr. Rushik worked for two United Nations agencies, the International Labour Office and the United Nations Development Program. She has published in peer-reviewed journals of AREA, in the following journals: AREA, Disasters in Environment and Urbanization, Urban Geography, and the International Journal of Disaster Risk Reduction. Her 2019 co-edited digital magazine, Laboring Urban Infrastructure, is a collaborative creative experiment in thinking about feminism, the urban infrastructure, and invisibility. You can check out her website, hannahrushik.weebly.com, and we'll put the link up for that throughout our conversation today. It gives an overview of her research on livability, gender, social infrastructure, and community resilience. Hannah and Maheen, thank you so much for your time and welcome to COVID Calls.
Thank you for having us.
So let's start the way we usually do, which is just to find out where you're calling in from and what the pandemic situation is looking like there. Maheen, can I start with you, please?
Yes, certainly. So I am currently living in Maastricht in the Netherlands, and I've just arrived here about a month ago, a little more than a month ago. The situation was quite all right when I reached. The cases had decreased, and even the measures, the safety protocols were much more relaxed when I had come in. However, very recently, the cases are on a rise again in Belgium, France, and also in Netherlands. And we have a fresh new set of lockdown measures in place actually that started from yesterday. So that is the current situation in Netherlands right now.
And did you have to go through some sort of quarantine procedure when you arrived?
Yes, so I flew from Bangladesh in the middle of August, and I had to be in quarantine for 2 weeks when I arrived here. I did take a test right before I left for the Netherlands, so I took a COVID test in Bangladesh before I could fly. So there were some measures in Bangladesh as well from the government in order for you to take a flight overseas.
And what about the university? Are they doing classes in person, even though the numbers are ticking up, or is it going to be remote?
No, unfortunately, our cohort for the course that I am enrolled in is one of the biggest that they've ever had. And they're not being able to accommodate the students in a classroom environment, given the large number of students. Hence, we are currently doing online classes.
Okay, so this is a master's in sustainability, science, policy, and society. And you said it's the biggest class they've ever had?
For this course, yes. It's quite a new course as well, and this is the biggest cohort, yes.
Oh, okay. Well, good luck with that. I'm sure we'll hear more about that as we go along. Hannah, same question to you. Where are you calling from, and what's COVID-19 looking like there?
Well, I'm calling from the UK. I live in the northeastern part. And I think the UK is sort of competing with the US in terms of its ability or inability to address the pandemic. We're under what they're calling a local lockdown, which is impacting 2 million people in the Northeast. And at the moment, we are unable to socialize with people outside of our households unless we're in a business meeting. So it's really difficult because people, the rules and regulations aren't very clear, and the government is constantly doing U-turns. And British people like to follow the lead of the government. So it's really difficult when the government is unclear on how it wants British people to act. And at the moment, 1 in 10 British people have accessed food banks between April and July of this year. So people are skipping meals and going hungry. And this is according to the government's food safety watchdog, which is the Food Standard Agency. And this has really impacted young British people between the ages of 16 and 24, and those with young children at home, and not the elderly, which is for me quite interesting. And also about 16% of adults in the UK are food insecure, which is about 7.8 million people. And a good portion of those have fallen into food security because of the virus. So I think the UK, there's increasing levels of precarity, and the years of austerity have really hurt a lot of people in the UK, and COVID is just really tremendously hurting people.
I have to say, it's to me has been an unexpected and unfortunate basis of transatlantic solidarity to see both the UK and the United States following, at least early on in the pandemic, the path of denial.
If we treat it like a war, we can fight it like a war, right? I mean, it just doesn't work like that.
No, not at all. And as you described, I want to ask you a little bit more about this so-called local lockdown that affects 2 million people. How does that register in terms of fatigue? Because in the United States, in places even where there's a very strong effort to comply by state level mandates to wear masks or social distance, people are chafing against those restrictions because it's been a while now and it's hard. We have not been ordered into this much more restrictive mode that you're describing. I can imagine that that's really wearing on people.
British people want to follow the law. They want to do the right thing. So there were issues. Some of the issues have started because some government officials have not followed the laws that they've asked citizens to follow, and so that was sort of galling for the majority of British people, because they were following the law, not meeting their family over Easter, and yet there's these instances of senior government officials doing that. And the government officials sort of being surprised that the people didn't break the law. So it's really problematic, because people want to do the right thing. All over the world, they want to do the right thing. They just need governments to lead them. And I think that's where the problems come in, with all the conspiracy theories and whatnot, is if there's just not a clear, articulated message for people to follow.
Mm-hmm. So we've touched a bit on the Netherlands and on the UK and the United States, but we're here today really to talk about Bangladesh. And I really appreciate this discussion because we have tried to bring as much of a global perspective as we can to COVID calls, but it's been very North American centric, and I'm going to work hard on this in the next couple of months to really broaden that. And so thank you so much for your time on this. And can you just give us some context to work with? Maheen, I'll start with you, and then Hannah, about how COVID-19 has played out in Bangladesh. What's been the evolution of the virus, the government response?
Yes, certainly. So in Bangladesh, if we start from the very beginning of the onset of the pandemic, the first recorded case was discovered in March. That was the official recorded case, and the government declared a general holiday. That was the official term being used to refer to the lockdown towards the end of March. And so it was just like the lockdown measures were similar to other countries, but the situation obviously played out very differently if you compare it to the global north. But it was more similar to countries in the global south, with multiple levels of impact being faced by the population. So just a bit of numbers here. So the country faced a peak between June and July, a peak of infections and cases. And currently, the cases are at 363,000, the total number of cases, and the total number of deaths stand at 5,251. And the number of recoveries currently stands at 275,000, again, approximately, a little more or less. Also, I got some stats very recently. It's recorded by Anadolu Agency. As of 23rd September, the recovery rate was actually 73.1%. There are more in asymptomatic symptoms in the populations that has been discovered. And also it must be noted some of the things, like there has been some criticisms in terms of that there wasn't sufficient testing taking place from the very beginning. There has been some scandals as well, where tests were published. There were fake tests being published and given to patients. So, for example, migrant workers from Bangladesh, when they were going back to Italy, where to their places of work in July, when they landed at the airport, their certificates, the COVID certificates, that the test that they had given in Bangladesh before boarding the flight, they were negative. But when they arrived, a lot of the workers tested positive for COVID, and this led to Italy posing a ban on travel for Bangladesh, and this affected a lot of people economically. As you can see, I'm sure you already know, that the migrant workers actually contribute majorly to the economy of Bangladesh. Also, another point is that the clusters of infections have been more or less in urban areas as opposed to rural areas. And some of the factors could be because of lack of testing, like a tracking system, tracking system, and also multiple community initiatives being undertaken, which we will get into more in details later on this podcast. But that was some of the points of evolution in the country in the pandemic. The government response has been, when it started, the testing was not as efficient. It's still one of the countries in the world with the lowest number of tests being undertaken. However, after the debacle in Italy, the testing centers have improved. There are more. They're trying their best to roll out as many tests as possible. And when I was flying, for example, I went to. You had to take the test in army controlled environment. So the testing center was managed by the Bangladesh military, and it was very well organized, very well structured. So I think that was one of the initiatives that came out after the debacle that happened with Italy.
Can you tell me a little bit about the Bangladeshi Health Service? Is it very centralized, decentralized, or you pointed to some of the problems with making testing and tracking available, and certainly Bangladesh is not alone in countries that have faced that, but maybe you could describe a little bit about how the structure works.
Certainly. So the health system in Bangladesh is rather pluralistic. There are systems coming from the government, the private sector, and also the non-governmental organizations. The non-governmental organizations are either donor funded or they're locally run. Historically, the focus has been on rural sector, and this is because post-liberation, the country was more agricultural, and also a majority of the population lived in rural areas. So a lot of attention has been on the rural healthcare system, and the structure there, it's well structured. The government had a very well planned out health system for the rural sector. It reached from the district level to the sub-district level to the union level. Also, there were availability of door-to-door facilities. For example, door-to-door vaccination was available for remote and grassroots communities. So that was very well planned and structured. However, there was a lack of attention on urban healthcare. And obviously, fast forward a couple of decades, the major urbanization was taking place in the country. From rural to urban areas, people were migrating for better economic opportunities. And this led to a lot of people living in slums. So there was an increase in slum dwellers in cities, for example, like in Dhaka. And obviously, this resulted in health issues, which can be sourced from lack of sanitation and overcrowding. So this led to some initiatives in the late 90s. For example, the Asian Development Bank financed Urban Primary Healthcare Project and USAID Smiling Sun. Also, the European Union experimented with some facilities that would be available to the urban poor. Bangladesh actually achieved Millennium Development Goal 4 by 2015 and had reduced child and maternal mortality rates. It was also able to reduce infectious diseases like tuberculosis, malaria, and diarrhea. And it was very successful in achieving the Millennium Development Goals, as you must already know. However, the last few decades, there's a substantial change in the socioeconomic indicators. The life expectancy currently stands at 72 years. The country has also graduated to a low middle income category. And because of urbanization, it has been discovered that non-communicable diseases are actually a major cause of death right now. And that is quite challenging for the country at the moment because there is lack of development for that sector. The country has achieved great strides in communicable diseases and also child and women's health because there was a huge focus on child mortality, infant mortality, and maternal mortality, and it's known for those achievements. So currently, that is the situation of the public health sector.
And just one more follow-up there in terms of the politics of health in Bangladesh. Do you have a health minister who's had to answer for some of you said the high case and fatality rate and the disappointment there, many people obviously in Bangladesh. Who answers for that?
Yes, of course. I mean, that is there. There is the health minister as well, but it has been it has been interesting to see the events as they unfolded, because I think with COVID-19 being so uncertain, a crisis, and the resulting factors, so whether it's socially or economically, it was quite difficult for people to grasp the concept of a lockdown. And I think it was equally difficult for governments, whether it's in Bangladesh or any other country, to deal with the situation because it is so novel in its way. But yes, I mean, the government has been there. It has been trying to answer the uncertainties, but doing their best.
Hannah, let me bring you in. Maheen, thank you so much for that sort of context that you've laid in for us. And Hannah, would you like to respond to any of that?
I think Maheen did an excellent job of providing an overview. I think what's really interesting for me as an outsider or as a foreigner is to see how COVID-19 is almost an affluent virus. It's in places such as Bangladesh or Nepal, for example, where I've worked for quite a long time. The virus was brought in by people who have traveled abroad. So it's the upwardly mobile, or it's international migrants. For Bangladesh and Nepal and India, it's young people, young bodies who are providing the remittances for the country. So it didn't hit the rural areas right away. It really was an affluent and urban phenomenon. So that adds a really interesting dimensions to the pandemic when you think about it in spaces in the global South, which is very different than the US or the UK. That's all I wanted to say.
Yeah, and I think there's a part of that um, is important to underline, which you both touched on, are migrant workers who may be any number of places, whose families and extended families may be very much relying on remittances, finding themselves either out of work and unable to get home, or unable to work when they were. I mean, there's all manner of permutations of problems there for people who get stranded. And we've talked in COVID calls, other cases about workers who get caught in the US Mexico maelstrom, and that's a whole set of problems in the US. But that, I mean, that dimension of it is one. Are people looking at that as the kind of thing that you can get a handle on statistically?
I don't have those statistics, but I'm sure they're available. But there's a big issue related to stigma. So when the migrants come back, I had a phone call this morning with my colleagues in Nepal, and so they talk about the migrants being embarrassed or being stigmatized that they have this illness and that they are the contagion, to their communities. So it's absolutely devastating. And then also, how do you occupy young men, in rural areas? Young people need jobs. And young people, so there's a lot of issues coming up. And definitely governments are aware of them. Their social, their economic, health implications. It's tremendous. So it'll be really interesting to see how this evolves in the next 5 years. What percentage will go back, which ones won't, and all of that.
Maheen, can I bring you in on this issue of the stigma of returning workers who find themselves in a position where they're not only having their responsibility to family and extended family disrupted, but also they're introducing the virus?
Yes, there's actually another interesting dimension to this. I was reading about this, so there's the stigma of returning migrants, right? So when migrants are when they were going back to Bangladesh and their villages, we actually published stories on this under the Voices from the Frontline initiative. But there's another dimension which is quite interesting, is migrant workers who are actually living in Italy after the whole incident that happened in July. Those who were already living there, not returned back and went back. No, those who were already living there were actually being stigmatized, because on a community level, people are saying, oh, these people are bringing the virus in Italy. So they were shadowed under that umbrella. So the stigma is actually playing out in two ways. It's not only at home when the migrant workers are returning, but it's also where they're working, and they hadn't returned. These workers didn't do any of that, but still facing another type of stigma there.
It also speaks to yet another reason that migrant workers will be reluctant to get tested if they can avoid, or if they can stay out of the health system, maybe not even seek care if they're sick, so that as you said, if the stigma is working both ways, that's a lot of incentive just to avoid, unless you're in dire medical necessity, to avoid that kind of tracking. I want to remind folks that you're listening to COVID Calls, and we're talking about Bangladesh today and the experience of the pandemic with Maheen Khan and Hannah Rushek. And I want to, Hannah, can I turn to you and get a little bit of your sort of research background on this? Because, as we were just talking about, there's the disaster, but our notions of disasters are often impoverished, because we think of, well, people die in the fire, they die in the earthquake, or they die of COVID. It's a much wider circle of distress, and I know that's something that you pay attention to. Can you talk about the kinds of issues that you care about?
Sure. I'm an urban geographer, and I work at an Institute of Hazard, Risk, and Resilience. So what I'm interested in is this intersection of how people live their lives every day, and then what happens when events occur. So an event can be an earthquake, an event can be change in government, an event can be the pandemic lockdown. And so what happens to the way people live their lives? Who do they rely on, and how do they get by, and how do they then incorporate these ruptures and then continue on? So I've been working with ICCAD, the International Center for Climate Change and Development, for a little while now. And we started last year working on a project about livability. So what makes cities livable to the residents? Because if we go to some cities, we may not particularly think they're interesting or even livable, but for the people who live there, they are. And so what we're trying to understand is instead of rankings, global rankings of livability, we should be listening to residents and what they're interested in. So we did 200 surveys. We did street theater, photography, filming, focus groups. So we mixed social sciences and humanities. And we got a wealth of information on 2 cities that are on the coast. So they're impacted by salinity, climate change, they have water issues. And then we were able to access, a colleague of mine, Faisal Rahman, and I were able to access some funding to do a rapid response project in these cities to understand what has been the impact of the COVID lockdown on food security. And I'm using the phrase lockdown because that's the really interesting, that's the really important element when we talk about cities in the global south. It's not so much the virus, it's the lockdown, the inability of people to earn money. Mm. And when the everyday is already precarious, where we know that in the autumn, people were eating 3 meals a day, primarily rice-based, but with vegetables and some meat. But we do know that 84% of the people that we engaged with in these cities of 102,000 people, 84% of them had either no savings or savings up to 2 months. Okay, now this is also similar to the US and the UK, sure, in terms of the savings level. But the level of precarity is much higher in a country such as Bangladesh. This would be the same for Nepal. So they don't have much of a cushion. So when the lockdown hit, and the lockdown was really long, so people followed the law. They didn't go outside. They would have also been penalized, and they would have had problems with the police. But it was the lockdown that made people suffer, and so that really dramatically hurts their livelihood strategies. And so I think that's what we're trying to understand now: is what is that relationship between food security, livelihood strategies, who's been most negatively impacted, and what kind of support did they receive?
I want to highlight an article that you co-authored that was published in July, and the conversation has been publishing really good articles throughout the pandemic. And I just want to quote, you write here, so you're talking about one of these cities you're talking about is Mongla, which is on the coast, and you say, many residents in Mongla experienced near or complete loss of income during the lockdown, which restricted almost all economic activities. People were only allowed to leave their homes to buy food during a 4-hour period each day. Day laborers, street vendors, small businesses all saw their livelihoods decimated. One rickshaw driver who we spoke to, you write, in late May told us, this lockdown is making us suffer for several months. I have never seen anything like this. Before, if there was a disaster, we survived with our savings, but this time savings are not helping much. Tell us about that man.
He's someone that we've worked with for quite a long time. And so he's also a community leader. And this part of Bangladesh is regularly hit by cyclones. There's 2 cyclone seasons a year, and Mongla and Noapada were both impacted by Cyclone Amphan, which occurred also during the lockdown. Right. So when crises occur, such as the regular cyclones, people gather together and they support each other, and they get by. But the lockdown was so long, and it needed to be that long, but it was so long, it was 10 weeks, that everyone used up all of their savings. So the people that they normally would have gone to for some support, their neighbors, their extended family, the others, they also didn't have money. So more people fell into poverty during the lockdown, and it was the lower middle class. And so all of a sudden, this continuum of who is middle class is primarily based on levels of education from the people that we engaged with, rather than income. But nevertheless, people who historically never asked for support from the government or from NGOs now were needed support. and they weren't on any registers for food packages. And so COVID, the lockdown, cities, it's showcasing a group of people who historically haven't needed support, who are now really in a precarious situation. And it was the length of the time.
Do you have any indication, as you pointed out, this is a part of the world where they see 2 cyclone cycles a year? These are not strangers to weather-related disasters, and also we're going to talk about climate change in a minute. They've got weather-related disasters and climate change-related disasters, so 2 different temporalities unfolding here of disaster. But somehow the pandemic is exposing inequalities or vulnerabilities that were not well understood. How can that be?
Maheen, do you want to try and answer, or do you want me to?
Sorry, do you want to start and I'll then come in?
I'm just going to say a short bit, and then I think Maheen can talk much more about it. I think there's so many people that are, just on that cusp of not being able to make ends meet. And something like 35% of the people that we engage with don't have enough money to cover their monthly expenses, so they're constantly borrowing. But now it's a much larger group of people, and that's the problem. It's that all of a sudden it's too high of a percentage of the population. I can't give you that percentage, but it's just much more problematic. Maheen?
Yeah. Okay. So one of the biggest learnings of vulnerabilities coming from countries like Bangladesh during the pandemic was the daily wage workers, how they were affected. And we forget that countries and economies like Bangladesh, they are very much reliant on the informal sector. Majority of the population are actually working as informal workers, and they are dependent on a daily wage for livelihoods, for survival. So when Hannah was saying that it was the lockdown, it was, yes, there was the health dimension, but the impact of the lockdown on the social and economic indicators was massive for a country like Bangladesh, because these people were not being able to earn any income. They were not being able to put food on the table for their families, or they couldn't even try to do it. Even if they somehow could make ends meet, there wasn't any possibility because there were no opportunities out there. So one of the first impact would be, I would say, the vulnerabilities coming to the surface is the day laborers. Then the other was what we just spoke about, is the migrant workers. How they were impacted, how they were being sent back from overseas to Bangladesh because, there was no work available anymore. Nothing was working, and they were just, they were a burden on that economy. And this is one of the themes that we talk about under the Voices from the Frontline initiative. This is an emerging message that these workers, migrant workers, and they need more protection and security in the economies that they're working in. The other effect is also the vulnerabilities of minorities. Like, for example, I interviewed a transgender activist, and she works with the transgender population in Bangladesh, and how they have been impacted. Like, we can just go deeper and deeper. There are so many levels that are individually affected. So, for example, I'll just give you one example of this, referring from my interview, is that she was telling me that when people from this, when transgender people were going to access food relief packages that were being given out by the government, they were denied because they were told that they are not in the list. Hence, they cannot access these food packages. So that we don't think about these things. Yes, it's available for everyone. Everyone can access it. But what are the qualifications? What are the criteria? And these things came to the surface. And there were many initiatives. There were ration cards being distributed by the government. There were food relief packages. But unfortunately, not everyone could access it. And that exacerbated the inequalities among these populations.
So, go ahead, Hannah.
it's really important to understand that in countries such as Bangladesh or Nepal, the governments have learned how to support people really quickly when a crisis occurs, a hazard event or the pandemic. So these lists are lists of poor and vulnerable people in cities and in rural areas. So the local authorities immediately handed out staples, so rice, lentils, soap, oil, things like that. So people could get by for that first month.
Right.
So they had enough food staples as donations for that first month. It was that second month, the second 6 weeks, and then there was Eid, which then just really, really hurt people. So I think there are systems in place to support people from the government, which are effective. But then the question is who falls through the cracks, which is what Mihin's talking about, or what I mentioned. So I think, and it's also, I think, really important to understand that that residents trust their local authorities. That's really important. So they listen. People didn't. There wasn't. So anyway, with the cyclone, it was just. There's trust. There's elements of people working as a collective and supporting each other. So there are really strong elements of society coming through in the times of crisis as well.
I also wanted to add, that some of the vulnerabilities are also interlinked. And for example, we, as per some of the stories, again referring back to them, some of these migrant workers who were actually coming back and they were facing the stigma and they didn't have anything to do, that resulted in a rise of gender-based violence, that resulted in a lot of issues, domestic violence as well. And also the other issues that got exacerbated during this period is there was a rise in child marriages as well. And there has been studies done to monitor these. For example, a foundation in Bangladesh called Manusher Jonne Foundation, they carried out a survey, and then it was said that more than 4,000 women and 400 children faced domestic violence during this period in 27 of the districts out of 64 districts in Bangladesh. And in this survey, 17,000 women and children had been surveyed, and one of the things that came across was also early marriages, and this was to ease off financial burden that was prevalent during this period.
One of the things about the COVID-19 experience globally is that we try to get our mind around these numbers and the scale of things, but the power of these individual narratives is really, really worth, I think, our attention. And Mihin, you've been writing a lot, and I want to just read a sentence from a piece you wrote earlier in the summer, and this is about Shuli Ishrat, who lives in Aftabnagar, Dhaka. And you write, near her home is an informal settlement mainly inhabited by daily wage workers, 100 families, each comprising multiple family members with a total of 320 residents. Here, the COVID-19 crisis, so this is what you were just alluding to, has led to massive job losses and food insecurity. Many of the women living in the settlements are domestic helpers and have lost their jobs because outsiders are restricted from entering private houses for fear of contagion, says Shuli. Can you tell us more about her and her experience? I mean, I think the power of these narratives has to be really reckoned with.
Yes, definitely. So it has been quite an eye-opening experience for me to work in this project with my colleagues at ICAD, because we've been exploring community self-organized initiatives. So we've seen that across the world in communities, in remote communities, grassroots communities, members of these communities are coming together and implementing self-organized initiatives to support the most vulnerable. And it's been fascinating to see how small initiatives has been having a ripple effect and has been really impacting the community as a whole. So this specific story that you just referred to, I interviewed Shuli Ishrat. I actually read about her in the national newspaper in Prothom Alo, and I reached out to her to understand more about her story and why she's doing and how she's doing it. So I wanted to also bring in that personal touch. So she simply just noticed one day that there were people out there. There was an informal settlement right in the neighborhood that she lives in, and people were just sitting in the streets, not doing anything. And she noticed that, observed that for many days. And one day she just went up to them and asked, "What is going on?" And so they presented their situation to her, saying that, look, we're daily wage workers. This is how we work. We're either construction workers or domestic helpers, and we're out of jobs because of COVID-19 and its obvious effects because of the lockdown. So she wanted to do something. She wanted to, start helping them. She initially started by, reaching out to her community through social media, gathering some funds, food relief packages, and this was all privately coordinated by Shuli. And so this was the beginning of how she started to help these people. Then later she came up with this idea of a community kitchen. She realized and discussed with these 100 families, these people living in the settlements, that if we all cook together, it will be more cost effective, and I think we can all come together and help each other out. She also wanted to utilize their spare time, instead of having them sit idle and just access the food and money. She wanted them to be part of and contribute to a greater cause, and also themselves, for the welfare of themselves and the community they live in. So then she made devised this makeshift kitchen in the area that she lives in. Then later she realized that there were a lot of empty plot of lands available in the neighborhood. And then she discussed it with the informal settlers, that why don't we start gardening here, growing vegetable. So she reached out to the landlords through her network in the neighborhood, people who own those lands, and they wanted to encourage her. Some were reluctant, but she assured them that it would only be during this period of coronavirus. And that's how it started, the community garden, community kitchen, and all these people came together. Obviously there were safety protocols, there were safety measurements in place, the distance, there were hand sanitizer, hand washing facilities, everyone was wearing masks, and they were not eating together, mind you. They were taking the food to their houses and then eating it there. So all of those measures were in place, and she has been able to sort of manage that for a few months. And also, once the story was out there in the press, she could access some funds as well. And now she's thinking about how to help these communities such as these to somehow come up with alternative livelihoods during crisis like COVID-19, so that they don't fall into despair again in the future.
So what you've just told us, first of all, it's remarkable, and people want to check out more of your writing. They can check out this Voices from the Frontline series, which is part of the ICCAD website. I encourage people to take a look at that. And the story of Shuli Ishrat is really, what you're not telling us here, or what you're telling us is not what some might expect, which is that some sort of outside aid organization came in and brought in truckloads of supplies and just managed things. Now, maybe that's happening or maybe that's not, and you can tell us how Shuli's story fits into the broader story of relief in this moment. But what you've just described is what I would call mutual aid at a very local level, but highly organized and effective, as you've described it. Is that representative?
Is that representative of
the way that the response is happening in the country?
Yes, yes. Yeah. Certainly, and the stories that we have been publishing has been from all over the world, but they're so similar. It doesn't matter if the community is in Africa or in India, Nepal, Bhutan, Bangladesh, or even in South America. They have a very, very similar narrative of these communities actually organizing themselves and taking initiatives to support the vulnerable. And this is where we can learn, for the future, for future crisis management, how they're doing this, how they're actually organizing, coming together and actually helping each other out through collaboration. There's also a lot of fostering of relationships with local authorities in other instances. There's also a lot of awareness being carried out. And also what these communities are doing is they're utilizing resources that are available to them to cater to the needs of the people. And that's very interesting because resources usually in these communities are very scarce and very limited. So that's a very interesting narrative that we're getting out of these stories.
It's a powerful one. And Hannah, I want to get your perspective on this because, of course, social scientists are always, we're looking for stories like this and then trying to think about ways to what kind of lessons can be learned and teed up for policymakers, certainly, but also how they might compare to other cases that we haven't been looking as closely at. What's your perspective on what you do with a story like the one Maheen has said, how we can turn that into broader lessons learned?
I think that that solidarity and mutual aid and mutual support are everywhere. It's just a question of, do we want to see it? How to make that link to formal government structures, that's the difficulty. A lot of these informal mechanisms are led by women. And it's that link with the people who have money and power that doesn't happen because governments don't want it to happen. So after the earthquake in Nepal, for example, there was tremendous acts of Nepali people helping Nepali people. And that happened in the hours and days after the earthquake, before international aid came. But that's not written about. It's not seen because it might not necessarily be interesting for some to see it. But it's most certainly there. It's women's groups, it's self-help groups. They're there. They're all over the world. Yeah.
Just want to remind folks that you're listening to COVID Calls, and I'm talking today with Maheen Khan and Hannah Rushik about Bangladesh, but we're talking about issues that go well beyond the COVID-19 pandemic in Bangladesh. And I'm glad you brought in this, the Nepal case, and you've alluded to your work in Nepal. Hannah, before we were on, you mentioned you've got a book that does look at the earthquake. Can you say a little bit more about that? Because this is a regional discussion as well today that we're having.
I was conducting my PhD research in Nepal around community resilience and those acts of, how do cities survive under such difficult circumstances? And I was actually there during the earthquake, and then I left about 5 days after the earthquake, and I needed to do something, and so we co-edited a book called The Evolving Narratives of Hazard and Risk. And we published it in 2018. And what I'm really proud of with the book is that most of the authors are Nepalis. And so we tried to give space for Nepali academics and practitioners to give their point of view about the earthquake, rather than having foreigners write about Nepal's earthquake on behalf of Nepal. And so, of course, they write in a very different way than others would have written. But the book was written the earthquake was in 2015, and we wrote the book in 2016, beginning of 2017. So it's really quite raw in some places, but it's an important contribution of having of decolonizing knowledge and trying to have people from the country represent their country in academic discourse and in conversations such as this one.
It seems like that. Thank you for describing that, and I hope people will check out that book. Maheen, it seems that there's a similar set of tasks at the core of the Voices from the Frontline series as well, which is to elevate the stories of people that we might call experts if they were from the United States or Australia or the UK, but in another context, we call them community, or as Hannah says, if we call them anything, if we even observe them at all. Could you share with us, maybe we have a few minutes left, another story that we should be attentive to, like the one you were just describing of the community kitchens? Great story.
Yeah, sure. There are so many, it's difficult to choose. And a lot of them are actually just very, very similar. But I'll share one from Bangladesh as well. And this was it's on community savings group. So one of the things that we are trying to highlight, and I would also personally like to highlight, is the role of women's leadership in these community initiatives as well as youth initiatives. And one of the stories that was published a few weeks back was from the southwest of Bangladesh, and it was based on women's saving groups. And so there were this group of women who actually initiated and founded this savings group for women as well as the wider community. And what happened is, during the lockdown, because of the lockdown measures, they couldn't meet and they couldn't take out loans because they were having issues, obviously, related to income and livelihoods. So first few months they couldn't function as per usual. But then later, once they had the grasp of the COVID situation and the lockdown, it was fantastic to see how they reorganized. They reorganized to meet again, keeping ensuring that they have the safety protocols in place, but at the same time catering to the needs of the community when it comes to financial requirements, to giving out loans, and also to start the saving cycle once again. So that was really fascinating to understand how these women also, they took advantage of these groups to create awareness of the crisis, to create awareness on the safety protocols, as well as other issues like, again, child marriage, domestic violence that were also in the rise during that period. So that was also a story that was tremendously interesting to see how people are also reorganizing themselves. When they get a shock and there's a crisis, they don't know what to do, they move away. That impacts them, that impacts their daily lives, but then they come back together, and women's leadership has been monumental in some of these initiatives. One of the things that I want to highlight, and has been a result of the VFL series, is that we need to learn from these community-based initiatives. We need to learn from them, and we usually have women under vulnerability groups. We refer to women as vulnerable. We need to change that narrative, because that takes away a lot of, that limits their participation when it comes to knowledge production and decision making, by just categorizing them as vulnerable. So we need to change that narrative, and that has been there's a very interesting article which I can share later, co-authored by Suranjana Gupta and Sheila Patel, on how we need to change the narratives of a new normal. So yeah, that's been one of the biggest learnings during COVID, is these initiatives.
A profound statement to rewrite the narrative about women as vulnerable. Hannah, what are the first steps towards doing that? I think I've got you. I think you're muted, Hannah.
I said that's a really hard question right at the end.
I know.
God, what do I say? The patriarchy, governance structures. We have to fight. We have to have hope, and we have to fight. I don't know what else to say right now. That's another program.
Yeah, it's not fair to give you 30 seconds to deconstruct patriarchy within disaster risk reduction. But I think we've had some clues even in our discussion today about what we're looking for in our research, who gets to say, who gets to write, and scale. And I guess that way we're almost up on time, but that also strikes me, so many of the sort of global efforts at disaster risk reduction are geared at long-term adaptation to climate change. And I know that work has been robust in Bangladesh.
Yeah,
but
it's that fundamental disconnect between the scales,
right.
And the different actors. And community-based work takes a tremendous amount of time, and to a large extent, it's invisible. It's like the fabric of society. Women in their groups, and what they do helps societies to continue to function. It's off their bodies, it's their families, it's their it's their neighborhoods. It's larger. The problems happen that when the people who control the money, who set up the policies, are not really interested to hear the voices of women. They're interested to have the women do the work so that they can then build on that to do something else. So there's a fundamental disconnect. Yeah.
Maheen, I'm going
anyway, fighting, hope, activism.
Yeah, well taken. Thank you for those. And Maheen, I'm just going to give you the last word. Not to predict what we should see in Bangladesh necessarily in the coming months, but what might be, if we were looking for some clue to hope, to see some recovery there, what are you looking for? What's possible in this moment in Bangladesh as people do recover from the pandemic?
Well, I think the Bangladesh is understanding its how to improve on the public health sphere. I think the testing debacle, the sort of differences that has happened in the past few months, that has given rise to a lot of very much required attention to this nature. How the public health system needs to be more responsive as a whole to crisis like COVID-19. But I feel it's positive because there's, like I said, I mean, the country has a younger population. And we are seeing a lot of initiatives, both public and private. And one of the things that has come out from our research project that I was actually working with Hannah on the food security project is that, that people were there to help other people. There were rapid responses, whether it's from the government or from the private sector. People didn't go hungry. There was something or the other happening, and there was a lot of social capital to fall back on. There were people out there, whether be it neighbors or local shopkeepers or just friends and family coming to the aid of other people. So that social capital, that solidarity was very, very strongly embedded in countries like Bangladesh. So I am quite hopeful. I think that we need to learn from this. And I just wanted to answer that question. How do we do that? How do we change the narrative? By writing more stories, by giving voice to people, and by highlighting and bringing these stories on the surface. That's how it gets the due attention it needs. And that's how we start changing the narrative in the future. Whether it's women-led initiatives or community-based initiatives, that's how we initiate the conversation.
Just want to remind everyone, you've been listening to COVID Calls. You can catch COVID Calls every weekday at 5 p.m. Eastern Time. I need to release my guests because it is in the middle of the night where they are, and they need to rest and get up and get back to this work. Tomorrow, Maheen Khan and Hannah Rushek, I learned so much in this hour from you. Thank you so much for your time and the research you're doing, and I think we're going to need to check back in with you a little bit later in the year and hear how it's going. Can you both... I think you have work that you want to make sure we keep attuned to, right, Maheen? So this is tell us again where we find your writing.
So it's Voices from the Frontline. It's on the ICAD website. I can share the link. Yes, the more stories will be published for the next many months, till April. So.
Right. And Hannah, your research group, I'm presuming, will have reports and studies ongoing out of this work as well. So we'll keep up with and the center that you're in. Tell us one more time at Durham.
So I work for the Institute of Hazard, Risk and Resilience at Durham University. And my website will also have all of the publications. And I will always try to make them accessible to anyone who would like to read them.
That's great. Well, thank you both very much again. Tomorrow, we're going to be talking about the experience of Latinos in the United States and COVID-19. So stay healthy, everyone, and we'll see you tomorrow, 5 o'clock.
Thank you.
Thank you.